let's move on a little bit, talk about a couple targeted therapies. So erdafitinib is a pill, and this is actually a slide that was made for the New England Journal of Medicine, which is one of our top medical journals. This slide was made when the phase 2 trial, so a clinical trial of a test of erdafitinib was done in patients with urothelial or bladder cancer. They were looking at these pills, this oral therapy that was targeting FGFR mutations. So these are mutations that we can only find by testing the DNA or the genetic material of the cancer cells. And your doctor knows how to do this testing. And if we do this testing and we find these particular mutations, we can use erdafitinib as a targeted treatment. Targeted treatments are nice because they hopefully have most of their effect against the cancer cells that have this genetic mutation, because the person shouldn't have the genetic mutation, only the cancer. Now, of course, they have their own side effects, but the majority of effect is supposed to be against the cancer. And the patients that I've treated with erdafitinib have done well, but we of course need to watch out for certain side effects. But this is a drug that was approved just in the last couple of years. It's a targeted treatment for metastatic urothelial cancer, only used if we can identify the mutation in the cancer cells. So important to talk to your doctor about doing genetic testing for erdafitinib. So there are some kind of quirky side effects. These are the main and major side effects, the most common side effects for erdafitinib, also called Balversa. Things like mouth sores or feeling tired and sometimes blood count effects. These are very common for many of the things that we do. But for this particular drug, we also have to remember that there can be specific eye effects that are reversible, but we do need to work with an ophthalmologist to make sure that it's safe, and they monitor your vision and make sure that it's safe for you to continue to get this drug. If you do have any vision changes, we stop the medicine. Typically, those are all reversible, but important to be monitored for the eyes. And the other thing that this particular drug can cause that's a little unique is high phosphate levels, and that can be affected by diets. So you usually would do diet changes to lower phosphate. And then also sometimes we can use medicines to lower phosphate too. But these are two kind of unique symptoms or side effects of Balversa or erdafitinib that we just need to be aware of as we move forward and use this targeted treatment, which is highly effective.